All right, everybody, we can go ahead and get started. Hi, my name is Elizabeth Gurnt, and I'm a project director with Counter Tools. Thanks for joining us today for our local control webinar series, our first webinar in the series, Building the Rationale for Local Policy Change. We've got a couple of great speakers we're excited about today. But before we get started, my name is Elizabeth Gurnt. I'm a project director with Counter Tools. Counter Tools is a nonprofit that works with partners across the country to advance place-based public health by implementing and enforcing policy systems and environmental changes that promote health equity across communities. A lot of our work aims to reduce the detrimental impact of unhealthy substances like tobacco and alcohol at the consumer's primary point of exposure and access, being the retail environment. So today we're hosting this local control webinar series in collaboration with the Geographic Health Equity Alliance. The Geographic Health Equity Alliance, or GEA, is a CDC-funded national network dedicated to reducing geographic health disparities related to tobacco and cancer. GEA provides free training and support to state tobacco and cancer control programs and their partners on how to reduce health disparities and improve the health of communities across our nation. Our series today is focused on local control because we know that local governments are on the front lines of adopting laws and policies that have the potential to improve health outcomes and reduce inequities. That's why we're hosting this three-part webinar series to equip attendees with an understanding of why local policy solutions are so important, highlight some lessons learned about local policy implementation efforts, and hopefully share some innovative policy strategies that were built at the local level. So today we have three speakers, Brooks Rainwater from the National League of Cities, Nestor Davidson from Fordham Law School, and Sarah Bartel from ChangeLab Solutions. So Brooks, I'm going to go ahead and stop sharing my screen so you can get your slides up. And while you do that, I'll go ahead and give Brooks a brief introduction. So our first speaker is Brooks Rainwater. He's the Senior Executive and Director of the National League of Cities Center for City Solutions. Brooks drives the organization's research agenda, community engagement efforts, and leadership education programming to help city leaders create strong local economies, safe and vibrant neighborhoods, world-class infrastructure, and a sustainable environment. As an advocate for strong local leadership, Rainwater has published numerous reports and articles on innovative solutions that lead to vibrant and successful cities. He also speaks regularly across the country and oversees on issues facing city leaders. His recent research and interests include advancements in technology and city innovation, the sharing economy, and how the rise of state preemption is impacting local authority. So with that, I'll go ahead and hand things over to Brooks.
Great, thanks so much, Elizabeth, and thanks for having me out today. So my presentation is to talk about local control and the misuse of preemption.
Hey, Brooks.
Yeah.
We see your note screen at the moment.
Okay, let me escape out.
And just a note to say, we can save questions for the end. So we have three speakers. We'll go back to back, and then at the end, we'll have plenty of time for questions, but feel free to go ahead and stick those in the Q&A, and we'll make sure we get to those at the end.
Okay, I might keep it in this view because when I go to the full view, it just pushes to the notes, and I don't know how. Does that work? Okay, all right. So again, talking about local control and the misuse of preemption. And so to kick it off, for those that are unfamiliar, the National League of Cities is the voice of America's cities, towns, and villages. We represent more than 200 million people across the country. And so when we talk about trust in local government, I think it's really important to look at some of the trends that we've seen. Because while public opinion of the federal government has declined over the years, trust in local and state governments has been higher and more consistent. For a brief moment around the year 2000, all levels of government were trusted by nearly 70% of the population. But over the last 20 years, this was an outlier, and the federal government has generally been seen favorably by around 35 to 40% of the population. When we look at local government, however, it is the most trusted form of government. It has consistently been seen the most favorably, and during this 20-year period has seen favorability ratings of between 65 and 68%. Local elected officials know what is best for their communities. They are on the ground in their communities and are most aware of the needs of their residents. So talking about preemption, just to kind of give some of the overview here, kind of the key points. For the remainder of the presentation, I'm going to be speaking about what's happening within the preemption space And preemption is the use of state law to nullify a municipal ordinance or authority. In other words, it is when a state acts to limit the powers of a local government to govern on certain issues. Preemption is an issue that we are constantly monitoring at the National League of Cities because it has a huge effect on the ability of local government to serve basic functions for residents. And when we think back on the founding of NLC, we were founded on the premise of home rule and being able to have local control within your communities. And so something like preemption pushes directly against that. And depending on the state, the landscape of preemption can be very different. There are two main policies that we often hear discussed when we talk about preemption. First is home rule. Home rule is a delegation of power from the state to its subunits of government. This principle creates a local autonomy and limits the degree of state interference in local affairs. The powers and limits of home rule are also defined state by state. Dillon's rule is a municipal government may only exercise powers that are specifically granted by the state government. In states with Dillon's rule, state constitutions vary in the level of power they grant to local governments. So here's an example of local control and the value of it when you think about something like minimum wage. We've seen local governments make a big difference in a way that is not possible on the state level through policies like local minimum wages. Cost of living in a given city can vary greatly from the cost of living in the state more broadly, particularly when you think about urban versus rural areas in a state. For this reason, state control over minimum wage hurts cities as they try to meet the needs of local workers and businesses. We've seen this play out in countless states across the country, but one that always kind of struck me was the minimum wage laws that took place in St. Louis, Missouri, where the state preempted the city after they had already passed minimum wage law and that had been instituted within the city. You've seen a lot of back and forth in the state since then, and also before that law was passed, but it just really highlighted the fact that the city was trying to be responsive to things happening within that community and giving people a higher wage. And the state said no and kind of clawed that back. And throughout the country, you've seen this play out where a lot of states have said, no, you can't pass higher minimum wages within your cities. And we really need to allow cities to set a higher standard for something like a local minimum wage, which increases affordability within that community. And then preemption during COVID. This was a very, very big issue we saw play out all throughout the country. The pandemic was a time when local power became more crucial than ever. At the same time, governors and state legislators seized that moment to override local control through preemption measures. In 2020, several states went beyond rejecting the notion of a statewide mask requirement. They also pledged to block mask requirements instituted by any local governments. When it came to reopening, similarly, cities once again were caught between guidance from public health experts and the policies of their state governments. In several states, cities were barred from instituting their own gradual plans for reopening and forced to fully reopen before public health guidelines recommended doing so. In several states, this actually resulted in spikes in COVID cases. In a crisis, this was incredibly local by nature. The need for local governments to determine their own regulations was readily apparent. Unfortunately, this polarized time led to significant conflict between local and state governments, though, and ultimately became a major target of legislation to preempt local governments. So one of the things we did during the pandemic was trying to show the value of local control. The dramatic actions that cities took during COVID was one of the most stark examples of the benefits of local control. At the beginning of COVID, when there was little guidance from federal and state authorities, local governments became the authority, implementing mask mandates, new regulations for businesses, and local shutdowns. While the speed of reaction from state and federal governments was slow, local governments were nimble and responded quickly. And what we did at the National League of Cities in response, one of the first things we did was to establish our COVID-19 local action tracker. Because what we were trying to do here was record the emergency responses of cities, how they were responding with mask mandates, lockdowns, all the other things that needed to take place early on. And then obviously gradually shifted throughout the pandemic so that city governments could understand the actions of their peers, really sharing those best practices so city leaders knew what to do. And over time, it was the most complete collection of municipal responses to COVID and has recorded nearly 5,000 policies from 777 different cities that are home to 106 million people. So this tracker gives a powerful view on the strength of local government. In response to COVID, local governments were able to adapt, not only for public health purposes, but also to create communities that were more responsive to the needs of community members during that time. Now, when we think about kind of the post-COVID time period, what we're starting, I guess post-COVID is kind of a a misnomer, endemic phase of COVID. Local democracy is something that we've been very, very focused on thinking about preemption. Because leading up to the 2020 election, local governments realized that voters may be hesitant to risk their health amidst the pandemic by casting a ballot in person. And in response, cities around the country like Philadelphia, Milwaukee, and Miami expanded access to mail-in voting. Since that election, at least 19 states have passed 34 laws restricting voting access and limiting the authority of local election officials. And even more bills of this kind are being proposed in the 2022 legislative session at the state level. Voting rights advocates have raised the flag that these laws will disproportionately affect communities of color that have been historically disenfranchised in their access to the ballot box. These laws create statewide barriers to voting and restrict local government's ability to expand voting access. And this is dangerous for democracy. And unfortunately, as I said, we're continuing to see this happen, earlier in the year during the legislative sessions, and we're afraid that it's going to continue, in 2022 elections as well as going into 2024. So the last couple of slides here, I want to talk about some of the trends we've seen in preemption. Over the past several years, the scale and scope of state intervention against the authority of cities and towns has escalated, but preemption is an ever-changing landscape, and the policy areas that are targeted by state preemption have definitely evolved over time. In 2021, state legislative sessions resulted in over 400 preemption bills, more than twice the number of bills tracked during the 2019 session. So again, I wish we could say that the policies around preemption were getting better, but the data is not pointing in that direction. There's several reasons why preemption has been on the rise over the past decade. Corporations have been funding state elections to reduce local regulations, including blocks to minimum wage increases and ride-sharing apps. Preemption has increased over the past decade, but counter preemption, thankfully, has also increased. We've seen that in states like Colorado, where they've repealed minimum wage preemption, and Arkansas repealing municipal broadband preemption. Many of these counter preemption efforts are from new campaigns and champions for local control and cross-issue local, state, and national coalitions. So this really speaks to the groups that are here today, as well as many others and all of the local officials that are out there making the case for why it is we need to fight back against preemption. And so to close out, I want to address issues of preemption and home rule reform. NLC collaborates across several local and national organizations and interested groups. We work with the Policy Surveillance Program at Temple University to track preemptive laws for 15 district policies across all 50 states. These policies range from paid leave to ban the box and relate to local authority and social determinants of health. We work with our state municipal leagues, which NLC was originally founded by state level groups called our state municipal leagues, and they are members of the organization. And so we do annual tracking reports that support them during legislative sessions so they can advocate against preemption and home rule reform. And then we partner with groups like LSSC to advocate for home rule reform and work across interested national organizations. And of course, we work with municipalities and local officials to educate and discuss preemption reform issues across the US. And as I close, again, this is an issue that is so core to what the National League of Cities are, what we do, and mayors and council members all throughout the country are doing what they can to fight back against this impingement on local power. And with that, I will pass it over to my colleagues to go a little bit deeper into these topics. Thanks, everybody.
Thanks, Brooks. I'll give Nestor a second to get set up while I introduce him. Oh, he was quick, but Nestor Davidson joined the faculty of Fordham Law School in 2011 and was named the Albert A. Walsh Chair in Real Estate, Land Use, and Property Law in 2017. Professor Davidson has published widely in the fields of state and local government law, property, and affordable housing law and policy. Professor Davidson practiced with the firm of Latham and Watkins, focusing on commercial real estate and affordable housing, and served as Deputy General Counsel at the U.S. Department of Housing and Urban Development. Professor Davidson founded and is the faculty director of the Urban Law Center. So I will hand it over to Nestor for the next part of the presentation. Thanks.
Thanks so much, Elizabeth, and thank you, Andrew. And thank you for having me and for all of you for being here. I'm a law professor, so apologies in advance for a little bit of a deep dive on the legal side. I also work, Brooks mentioned the Local Solutions Support Center. I work as a consultant with LSSC. I also work very closely with ChangeLab. So I'm delighted to have the chance to talk a little bit more, particularly about the legal foundations for local policy change. although I'm going to get a little bit into the rationale as well and some opportunities, I hope, for reform. So just to kind of lay the foundation, and this is going over some ground that Brooks covered, but just to kind of connect it more broadly to the legal foundations. So I think from a public health perspective and thinking about the link between local control, local policy change, and the pandemic, I think there's some broad lessons that we're beginning to grapple with. One is that this long trend that Brooks mentioned and the data that NLC has collected on the increase year over year, particularly over the last decade or so, really left cities when the pandemic hit and when the crisis hit in a much more vulnerable position and undermining public health authority, but also the broader tools that cities have to respond, whether again, it's minimum wage or it has to do with the traditional core powers that cities have, other local governments have over questions of land use and eviction moratoria and the like. There were a series of policies that were really important to lay the groundwork for how cities could have responded. And in many parts of the country, preemption put a great deal of stress, and the abuse of preemption put a great deal of stress on that power. During the emergency, as Brooks talked about, there were some really critical flashpoints where local governments were really on the front lines of the public health emergency and weren't able to respond and had to fight pretty directly with the states in which they operate. Obviously, in much of the country, there was more collaboration, and the federal, state, and local levels all worked in harmony, but in too many places, that was not the case. And now, as we're in the long road of recovery, I think we have an opportunity to reflect on these lessons and really begin to change the fundamental structure in which these conflicts might arise. So to talk a little bit more, Brooks mentioned home rule and Dillon's rule. Let me just give you a little bit more detail. Happy to talk about any of this in the Q&A afterwards. But one way to think about Dillon's rule is as a baseline. It's the older norm. In many states, there are some local governments that have home rule authority, but if local governments don't, we assume that Dillon's rule remains the background principle. And as Brooks mentioned, it's a principle that says that as a matter of state constitutional and statutory law, local governments only have the authority that can be explicitly traced to a delegation from typically state legislation. And courts will read those delegations narrowly, read them in a way that is suspicious of local power. But many, in fact, most jurisdictions have adopted elements of home rule, and this is a movement that goes back to the late 19th century. So most states have some version of home rule. And just to break it down in a little bit more detail, because I think it's important as we think about the elements of local policy making, there are really two core elements of home rule. One is the ability to initiate policy. And under Dillon's rule, any local action, whether it's in public health or it's in land use or it's in policing or any other area, you have to point to a specific delegation. But with home rule, the default is that local governments, unless there is preemption, have the authority to act. And that turns out to be very important in public health crises. And then there is the ability to resist preemption from the state. And most home rule jurisdictions actually provide very little protection against state preemption if the state actually steps in to override. And that's where this abuse of state preemption has become such a critical way of highlighting the weaknesses of home rule. And I think that has led, as we think about the space for local policy making, to a much deeper understanding of the limits of even the best versions of home rule we have today. So the uncertainty about authority, when the pandemic hit, there were local governments that didn't know whether they could act. And that hesitation is really critical in an emergency, but critical in the long run as well. As all of you know, there's been a long-term hollowing out of local fiscal stability and capacity. That's a story that's much larger than preemption. Preemption plays a role. State tax and expenditure limitations on the ability of local governments to issue debt, just the basic inequity, and this is a really important place-based challenge. The capacity of local governments varies tremendously, and that's really a state law issue. And so all of this, I think, is giving a much greater impetus for reform of these basic legal structures. And so working with the National League of Cities, the Local Solution Support Center, and a wide array of stakeholders helped to develop something called the Principles of Home Rule for the 21st Century, which the National League of Cities published in a moment of spectacular timing, published in February of 2020. Some things then intervene. But this principles provides both a rationale, a logic to how to think about local authority and local policy making power, and actually a roadmap for real constitutional reform. It includes, and National League of Cities has taken the lead on this really over the space of a century, model constitutional language. And this builds on previous efforts by NLC to be a leader in home rule reform. So really quickly, it has four core elements in the principles. One is to shore up local authority, so there is no ambiguity. So local governments don't hesitate to make policy in the first place. Again, really critical in public health, but critical in so many other areas of local policy making. It shores up local fiscal authority and actually places an obligation on the state to, in the way that states are responsible, for example, for education funding, it says the state must provide at least a baseline of minimum capacity so that local governments can be responsive to their citizens. Third, it changes the presumption. So in most states, it's very, very hard for local governments in a direct head-to-head conflict with states to resist state preemption. Obviously, state preemption has an important role to play, whether it's in public health or other areas. States play an important role setting a baseline in many areas, a uniform regulatory baseline. States have a role to play where local action, local policies have spillover effects that aren't fully internalized, dealing with questions of exclusion. Those are all really critical roles. But so much of the real incredible rise in preemption that Brooks mentioned really has come in the absence of any of those rationales. It's a kind of ipsy-dixit. It's a kind of, we simply disagree with the policies at the local level and we get to say. And so an element of home rule reform would change that presumption, would at least require states to have a good reason for preempting local power and then to be able to defend that. And again, in many instances they will, but in many of the kinds of conflicts we saw during the pandemic around issues like tobacco control and so many other core areas where home rule and preemption has become polarized, politicized, that burden would not be met. And then finally, questions of democratic self-governance we think are sort of a core area. People should be able to vote on matters without risking the kind of punitive preemption that has become all too common. And so let me just close with a couple of thoughts to put this all in context. First, I do think now 2 years into the pandemic, and whether we're in the endemic, I'm not sure yet. That's beyond my expertise. But certainly in the conversations I'm involved in as NLC, as LSSC, as our partners at great organizations like ChangeLab have been in the trenches on preemption work, I think there is a growing hunger to move to structural change, to think much more holistically about the balance of power between states and local governments. I do think that raises really interesting opportunities for cross-issue coalitions. Certainly within the world of public health, we've already seen, I mean, public health was probably the first area where these fights arose, and public health advocates have been at the forefront for many years, really going back to the 80s and 90s. But as the new wave of preemption over the last decade has gotten worse and worse, we've seen collaboration across labor and the environment and technology. And there's so many areas of policy and so many stakeholders who have begun to realize that the ability to utilize local governments to be the experimenters, to be the front line, has been curtailed. And so I do think the arguments for local control really resonate across a pretty wide range of stakeholders. And I think the public health world has been at the forefront of this, but I think there's tremendous opportunity both to continue to resist the worst of the abuse of preemption, but now to pivot in a direction of structural reform. So let me stop there and hand it over to Sarah, but hopefully that gives us a lot to talk about during the Q&A. And again, thank you for letting me join you.
Thanks, Messer. Sarah Bartel is our next speaker. Sarah is a senior attorney at ChangeLab Solutions, where her good governance portfolio covers legal authority and preemption, the policymaking process, and cross-sector partnerships for upstream community health improvements. Her work spans issues such as healthy retail, food systems, tobacco use prevention, maternal and child health, shared use, housing, and support for working families. Sarah's legal background is in health, food, and the environment, as well as civil rights litigation. She's based in Fort Collins, Colorado, where she lives with her partner and their 2 kids. So I'll go ahead and pass it to you, Sarah, to get started.
Thanks so much. Man, I was really down to the wire there. I could not find my unmute button. Hi, everyone. I'm Sarah from ChangeLab. We're going to talk about kind of the tobacco point of sale and all of the great work happening around the country in that space amidst this rise in the shifts in public health authority with preemption as sort of a case study for this broader conversation. I'm going to be focused on the tobacco point of sale preemption playbook that we at ChangeLab put together in happy partnership with Counter Tools. We were so pumped that they proposed this as a way to lift up this good work and the resources available to support more of it. And of course now I'm in the Zoom. There we go. That's me. Hi, ChangeLab. We are, our mission is healthier communities for all through equitable laws and policies. But basically, we are a shop of lawyers and planners and folks who are public health professionals, all working together. We activate cross-sectional partnerships within the organization to support governments at all levels, but especially at the local level, to create upstream policy change for their communities. And as a disclaimer, because I am a lawyer, we don't enter legal attorney relationships. This is just information. My funding disclaimer, we're funded by the CDC. They are awesome, but I do not represent their views. I'm also not lobbying. That's another flag here. And finally, I just want to say when I'm talking about tobacco today, I am talking about commercial tobacco, not traditional or ceremonial uses in tribal and indigenous communities. So just as a quick agenda, I'm going to talk high level about health equity and local control and some of our basic ChangeLab resources. I'm going to focus on preemption at the point of sale in the tobacco prevention space, and then highlight a bunch of additional resources that will hopefully launch you into further study or actionable tools if that's what you're looking for today. So when we talk about health equity, we like to use Dr. Paula Braveman's definition, which is when everyone has a fair and just opportunity to be as healthy as possible, which requires removing obstacles to health, such as poverty, discrimination, and their consequences. When we at ChangeLab are talking about health equity, we are really talking about fairness and justice. One of our foundational documents is called the Blueprint for Changemakers, where we at ChangeLab outline our 5 fundamental drivers of health and equity. They are structural discrimination, which operates through policies and cultural norms and institutional practices. It includes structural racism. We're talking about income inequality and poverty, both at the individual level and the community level. We're talking about disparities in opportunity for access to education and jobs and economic opportunities, disparities in political power like voting, and governance that limits meaningful participation, which is a broader concept, not only about local government or state government or federal government voice, but also the institutions that structure our lives and our communities. And in our view, these fundamental drivers are essential to any policy work. And if you're not considering these drivers and using them as a fundamental driver in how you're planning your policy interventions, you might miss the mark. You might not actually create the change, and you might inadvertently create harms or exacerbate harms. So this is really important to us when approaching health equity proactively. We also, and I'm trying to use this like more and more, but like local power is community power. Public health authority, public health power is community power. That's where we've got the great data, the community goals, the lived experience. That's where voice can actually contribute to policy that's sustainable, not only because it has buy-in, but because it's built on the existing strengths of the community, right? This is where we have a lower risk of well-intentioned policies that actually exacerbate disparities because they're not actually connected to what's happening in the community. This is also the case because the Laboratories of Democracy Change Lab, right? This is where we can see proof of concept for scaling up, not only for local change or even institutional change, scaling up to more actors to a broader community level, but also for scaling up to state and federal policy change, right? We see this, I think, with the latest FDA action on menthol in the tobacco prevention space. So much work happened at the local level to make that conversation happen. And you all were there for it and know it all too well, right? So thinking about preemption and equity, and I know the other speakers really framed this up, Nestor and Brooks really framed this up, but just to skim over again, this is where you're setting minimum standards like minimum wage, but also minimum prices for selling tobacco products. Civil rights protections would also fall in this category, right? This is also where we see community-driven policy happening, and preemption limits that ability. You've got relevant protections not only for the community members and the groups that are affected by specific policies, but also for like local industry, local geographic factors, right? And equity via empowerment, right? Local processes are themselves a source of empowerment, and that is a source of equity in the community, right? So in the tobacco prevention space, when we're talking about equity, we're responding to the disparate health burdens that we've all been tracking and know all too well. Industry targeting, that's really explicitly proven how much things like structural discrimination and structural racism are at play, and like direct racism. Historical policy harms that have happened in the prevention space where, again, well-intentioned policies have disparate impacts that are unintentional and actually creating upstream harms as much as they're trying to create direct goods. Over and under enforcement where policies are meant to affect everybody the same and they're not enforced just right. And finally, the upstream influences, the stress, the allostatic load that contribute to making tobacco a choice to begin with, right? And it is a choice that people are using as a tool in their lives, right? So we're aware of all those structural issues that are influencing health equity when we think about local response. I'm also going to flag right here that Change Lab is a part of the Act for Public Health initiative. This is the Public Health Law Partnership. You can see all of our partners here. LSSC is involved, Temple's involved, the Public Health Law Watch. We've got legislative tracking and litigation tracking on the shifts in public health authority that have just like skyrocketed in the last 3 years, really seeking that affirmative approach to building support for public health authority and local control as a tool for community power, right? So if you're interested in learning more, I've also got a webinar that's happening tomorrow on messaging around making the case for public health authority that I'll share in the links later. So let's dive in a little bit more on the tobacco point of sale. This is our beautiful point of sale preemption playbook. Here is the table of contents copied out. You can see we go through some of the preemption basics in a, like I'm sure, a less nuanced way than Nestor would do. We've got case studies from Counter Tools and their great partners. We talk about local authority generally, progress under preemption when you find that you might be preempted, preventing and undoing preemption, reversing preemption even, and finally some additional resources from the field. It's a really link-heavy document, right? This is lifting up a lot of good work, putting it all into one place, building off of TA that we've been providing for decades from both organizations. So we go through authority. Y'all have already been through this, so I am just going to skip the types, the effects, common preemptive language with examples that are sometimes like super obvious, other times less obvious, right? Because it's a spectrum. Partners that you can contact to help you do that analysis so you understand what preemption might apply to you. This is one of my favorite examples from the book because really it's never going to be clear-cut. Very rarely, I should say, is preemption going to be clear-cut. How is state or federal law influencing what you can do at the local level? There's room for interpretation. It's shifting based on case law, based on judges and how they're changing. We're seeing, deference changing in the courts right now. It's like ever changing, right? So you're really not looking for a black and white, like, can we pass the policy or not? You're evaluating your level of risk. And depending on the level of risk that your legal or policy assessment reveals, and your comfort with where you live in that level of risk, you're going to do different things, right? But all of them are great and empowerment moments at the local level. So I'm going to dive in a little bit of these. This is pulled directly from the playbook. You can leverage non-policy actions. You can shift and consider policies that might get at a similar goal but are not preempted. You can move forward with a preempted policy, though there's a major big red flag caveat for that one. Or you can analyze and share information about what preemption is doing to you and how you do your work. So I've got this coded here. The first thing is you can hold, right? Keep your other policy actions moving instead. Get that local data set even deeper. Get your community members involved. Build out those leadership roles. Strengthen the enforcement of policies you've already got in place. Use incentive programs and other strategies for healthy retail, and develop those relationships with stakeholders, not only community members, but your enforcement, your business partners, your advocacy groups. And I want to especially highlight Change Lab, and I've got a slide for it later, but we've got a resource on assessments as a health equity tool at the point of sale, right? That data, that local data, both qualitative and quantitative, right? Surveys and quotes, data, numbers, right? All pull together as the basis for really strong policy, whether that's local policy or if you've got state change that needs to happen before you can do local policy. Those assessments are clutch for that work if it's going to be done equitably and with local voice. So that's the one option, right? Hold and dig deep on the local power that you've got, get that information together, get those partnerships built. Pivot is exploring policy options that aren't preempted. So if you're trying to do local retailer licensing and you can't do it, sometimes you can use local planning codes, zoning to shift the number of retailers, right? Zoning is a local power that is very rarely preempted, I should say. It's very often going to be untouchable, sort of. And that means you can use that tool to do some of the things that you might have done with a retailer licensing regime. So there might be a pivot option. The third here is go for it. And this is where I've got my big caveat. You need to work in close partnership with your attorneys if you're going to do this, right? The risk of getting sued if you pursue a policy that is preempted at the state level is, it's there. And so you've got to have your local attorneys on board, whether that people make that decision for a lot of different reasons. You're going to elevate the conversation. You're going to push the need for change. You might actually get it reversed if you proceed, right? It gives you cause for a case against the state if you believe that you've got a right to pass that policy, right? There are reasons we do this, but you have to be very, very aware of the added resources and the different type of resources that are engaged to make that happen, including national partnerships like organizations that we cite in our resources that can support you in doing that work. And we highly recommend that you reach out to both local attorneys and national experts in making that kind of decision. And finally, the option to analyze and share information, right? This is making sure that people at the local level, leaders and decision makers at the local and state levels understand how preemption affects your work. And that's where you're putting that local data and that local community voice together with your own authority and the need to put those two in action to show that there's movement and it needs to happen, right? And that's something you can do without lobbying. And so here's my little flag for the CDC's guidance that both shows you where your limitations are if you're funded by the CDC, but it also provides what you can do that is not preempted, all types of activity and information sharing that folks in public health and in tobacco prevention offices are really well suited to be doing that is not lobbying. And even if you're not a CDC grantee, you may find yourself working with a number of funders who limit lobbying, and that is a useful tool for you. These are the legal pathways to reverse preemption. This is one section of the playbook where, again, case studies are your friend. You can pursue state legislation to undo preemption. You can use ballot measures, or you can pursue litigation, that go for it option above, which you can either do after you've passed a policy that's preempted, or even proactively, you can say that it's violating your authority. And for this, I wanted to focus especially on the case study in the playbook out of our Colorado partners, Counter Tools, awesome Colorado partners, that are the example of just a massive partnership and community engagement effort to get together to repeal a state funding restriction that effectively preempted locals from enacting any licensing or fees or taxes for cigarettes. And that was repealed, and that local authority was regained, and you can read more about all the local work that has happened since. And that effort to repeal preemption as an incredible evidence of local authority and community power. So read more about it in the playbook, and then you can click even deeper to go to the Counter Tools website and get involved in like reaching out to the partners who were involved in that work if you're interested. Again, heavy on the resources. Tobacco and preemption resources, messaging materials, especially out of LSSC. BMSG, the Berkeley Media Studies Group, is the one hosting that. And as soon as I like stop screen sharing and can actually get myself organized, I'll share the link to that training. It's tomorrow. But again, it's this like making the case. What's the affirmative way that we can motivate action when we're talking to people about local authority, right? And how important it is. Technical assistance providers, organizational partners, and you can see it's all hyperlinked. It's super easy to use. For additional resources from ChangeLab, just so you remember what we're here for, we are funded by the CDC to provide technical assistance for those working on tobacco prevention and tobacco control. Join the Act for Public Health initiative if you're interested in being part of sort of a higher level conversation, again, that cross-sector work. All kinds of resources on preemption and public health and health equity, trainings, toolbooks, infographics, whatever your flavor. We've got our blueprint for change makers, really focused on local authority to change policy on a number of different issues, including tobacco, but also thinking about food systems, housing, community planning, partnerships with health sector, as well as our equitable enforcement guide, which I touched on a little bit earlier. Our model policies and playbooks and fact sheets and infographics, all and more tobacco prevention and control was like our founding subject matter area. So feel free to check us out. And the Frameworks Institute is another great communications partner for framing up these issues. They did a ton of research around the country about what messages actually work to motivate action in the tobacco use and prevention space. And you can find all of that here. There's a big brief that highlights the summary. There are recommendations, talking points, examples, some specific to the work you're doing in the field, whether you're focused on youth or policy or health equity or racial equity, others more broad and high level. So please check it out. Thank you so much again, and I look forward to the Q&A. Thanks, Elizabeth, for posting that. Everybody check the chat for the link. Oh, and I'll make sure it gets out to everyone.
Thanks, everybody. We will share slides, and I will put that link in our follow-up webinar or follow-up email as well. Even if you can't get joined by tomorrow, hopefully we can get a recording at some point. I see one question in the Q&A. Feel free to keep adding them while I read this one. We know that preemption issues arise in relation to social host ordinances, alcohol curbside sales, and home delivery, and retail marijuana sales in legal states. Can you talk about trends in these issues and provide other examples of where preemption issues arise in relation to coalition work in substance use prevention? Anybody have thoughts on issues with preemption around these other substance use issues?
So could you list out the areas again? That was a lot.
Yeah.
You know, I would say there are other organizations like NLC, y'all's like trends in preemption more broadly. I assume that was focused on COVID responsive preemption activity. And I know that like Americans for Non-Smokers' Rights is a really great tracking organization focused on smoke-free issues. I mean, Elizabeth, I actually would look to you for those retail specific responses in terms of what organizations have up-to-date tracking. Because we're in the TA role and not the tracking role, I have more like one-off experiences. And so I don't know who's holding that tracking work right now.
Yeah, so they were asking specifically about social host ordinances, alcohol curbside sales, and retail marijuana sales.
I
But
was
yeah.
going to say, I know that we tracked some of the alcohol curbside sales during the pandemic. They definitely showed up in our COVID-19 local action tracker. I don't know the number of cities that relaxed those laws, but it was quite high. And many times, of course, they did have to get authority from the state. And so that would probably be one instance where state and locals were working together well on some of those policies throughout the pandemic. I couldn't tell you what's happened to them now. I know some of them have been kind of put back in place, similar to some of the other things where we've seen space open on streets, and sidewalks widened and other things, taking space away from cars and giving it to people. Depending on the city, some of those have switched back to kind of the traditional patterns that you've seen too. So that would kind of be the kind of key pieces that we've been tracking on those topics.
This is maybe a super basic question, but if folks are trying to figure out what local authority they do have, what are your suggestions on the best place to find that information?
I guess I'll jump in. I mean, it depends on sort of the institution you're involved in. Certainly anyone involved in local government. I'll just echo what Sarah said, working with your city attorneys, your county attorneys, they are real experts in the nuances of not just what the general rules are in any given state, but often the scope of authority varies by policy area. So that would be a place to start. I would highlight, if you're not involved in an actual local government institution, Brooks mentioned the state municipal leagues. They actually do a lot of great work across the country in just giving general information about the scope of local authority in given states. They have, really great kind of general infographics. I do think there is scope if you're working with local governments and you're outside to ask them. I will say in general, the Local Solutions Support Center, we have a 50-state guide that gives very broad overviews and hopefully readable. They were written by lawyers to be read by non-lawyers, and that's always a bit of translation. That's not always easy, but I'm happy to share that resource with you as well if you just want a starting point to begin asking those questions.
That's great. Thank you. Andrew, I know you have a question. Oh, go ahead, Sarah.
Sorry, Elizabeth, I was just going to add to that, the thing, if you zoom out a level, the thing implied by what you just said, Nestor, is that preemption, oftentimes the legal expertise around it is going to be issue specific. So just to name that, like we provide a tobacco preemption guide because the areas of law are so nuanced and complex that a preemption analysis is often done by experts in the space.
And I mean, that's so important. And also it's dynamic. And so, I'll take an issue like firearms, which is a public health issue, and that's changing all the time. Colorado repealed its preemption of local firearm regulation. And now you have local governments in Colorado, and Sarah, I'm sure you followed this, exercising newfound local authority to respond to the threat of gun violence. And some states are moving in the other direction. And so not only do you need to be very issue specific, but you need to be pretty current because things change all the time.
Looks like folks are interested in that resource you just mentioned, Nestor. If you don't mind sticking that in the chat or following up with me, sure, so I can send that out afterwards.
I'm happy to share with you. Hard to multitask, but I'll send it to you and you can share in that.
Sounds good. Andrew, I'll hand it over to you for questions.
So I had two questions, and my second question is a bit related to what Nestor just mentioned. And I was going to direct it at Brooks, but I'm happy if everyone can answer it. My question is about how local control is resonating in today's politics. Brooks, I know that your organization is nonpartisan, so to the extent that you can chime in about this, I'd appreciate it. But it sounds to me like Nestor just mentioned that it sort of depends on issue by issue and even state by state. Are there broad trends that we might be able to take away, or do you really think it is really dependent on the issue? And I'm asking this as a tobacco control practitioner, wondering if something like local control for tobacco control policies for a decision maker might be completely different than discussing something like vaccination policies.
So I can start, and then Nestor has a lot to add here. So really what we've seen over time is that kind of the approach to things like local control and preemption have shifted and morphed based on politics also changing. And so historically, the premise around local control was seen as a small c conservative idea. And it was the idea that you could take decision making and do that at the closest level of government to the people. And so you tended to see a lot of Republicans that supported that very publicly, both at the national level, the state level, and the local level. And then Democrats, to some degree, supported it, sometimes not as much. Over the last 20 years, it's completely flipped most of the time, but not all of the time, to where you often see conservatives at the state level pushing back at policies that are passed by more Democratic policymakers at the local level. But again, it's not all of the time. I mean, land use is one of those areas where I would point to many Democrats being in disagreement with other Democrats, particularly out in the West, where you've seen a number of land use laws, a lot of pushback from local leaders, even though they're of the same party. And so to Nestor's point, it does play out kind of issue by issue. But if you were to see trends kind of playing out, you've definitely seen more preemption in states that are governed by conservatives over the last couple decades.
Yeah, I think that's absolutely right. I guess I don't really have much to add other than just to underscore how regional this can be. And there is, and Brooks, you mentioned this a little bit in your opening, there's a kind of entrepreneurial network of folks. ALEC is one example, where you get these model bills, and it's sort of a version of the laboratories of democracy, but it's one that tends to leapfrog the actual experimentalism and tends to, and this is true in public health, it's true in a lot of other areas. You know, that network can be very, very active. And so you get a policy issue right now, for example, just to pick a couple of issues from the spring legislative session that have been very, very active. So homelessness is an example where there have been bills in a number of states where essentially the states are trying to force local governments to essentially criminalize homelessness. A lot of issues around transgender youth, particularly in sports. And so you see these patterns regionally, but also where a bill gets introduced in one state and then suddenly you see it in 6 or 8 or 10 or 12 states almost immediately. And I think that is something relatively new. I think that those kinds of policy networks, you know, were not really quite as active 10, 15, 20 years ago as they have become in this arena.
Thank you so much. Okay, my second question was for you, Nestor. Are there any interesting parallels between the challenges during the rise of the home rule movement and what we are facing today? I was struck by your comment about, you know, potential coalitions we might be able to form now between public health and other areas. You know, did those sorts of coalitions appear at the time as with different advocates advocating for their own things, and did they have this spirit of home rule as a part of their work?
Yeah, it's a really great question, Andrew. And you know, the risk of inviting a law professor onto a webinar is I'm inclined to go on for about 45 minutes on this topic, but I'll give the short version because we've been doing some really interesting historical research. So the short version is home rule arises as a movement really after the Civil War. And it was originally somewhat of a coalition at a time when cities were growing rapidly. Immigration in the United States was really an urban phenomenon after the Civil War. And so you had a coalition of kind of large city machine politics, for lack of a better description, but newly empowered, largely ethnic coalitions, originally, you know, often in the Northeast, in the Midwest, as immigrants began to feel power, and then kind of good government groups, and for the much of the progressive era, the late 19th century, home rule was really a big progressive movement issue. and it was very much tied in with expertise and tied in with kind of, depoliticizing. And what used to happen in the 19th century before Home Rule was there would be these largely urban-rural flashpoints, and states would take power away from local governments in a way that like today could at the time was very polarized. And so Home Rule was seen as a way of depoliticizing a lot of these state local fights, and then recognizing places that were becoming much more diverse, places that were becoming much more at the forefront of policy issues. And that's really the origins of Home Rule. And we've had waves of reform since the progressive era, and the politics have been different at different times. In the post-World War II era, it had a lot more to do with the rise of suburbs and some perhaps slightly less salutary aspects of that history. But I do think the broader lessons are that there really are stakeholders who think about specific policy areas, and particularly areas. And I think public health is a really important example of this, where the natural role that local governments, that cities and other local governments play on the front lines makes a very strong case for local empowerment. Again, in the context of states setting floors, states thinking about uniformity. But when public health issues come up, whether it's cholera in the 19th century or the pandemic today, local governments and particularly cities are on the front lines. And then people who think about just governance in much more general terms. And as we've been going around, as we've been working with the National League of Cities, as we've been working with local elected officials, there are stakeholders out there who are less committed to any one particular policy area and much more concerned about problem solving, concerned about good governance. And I think for those groups, historically, Home Rule has been an important tool. And I think it can be again. So great question. Thank you, Andrew.
Thank you so much.
All right, thanks everybody. Any final questions? Feel free to put those in the Q&A, or we'll make sure to share email addresses in our follow-up email, and you can submit questions if you have additional ones that way. Thanks everybody for joining us today. And we will follow up with some additional resources soon. Oh, I do have one note about our upcoming webinar. The second webinar in the series is August 5th at 2 p.m. Eastern again. I'll put that link in the chat as well so that folks are able to register for that. You'll also should be directed to a follow-up evaluation. So please feel free to submit that as well. Thanks, everybody.